Hello, my name is Mary Beth, and this is my video practical. So this is my working area. I do have just the abbreviations for the anterior sickle and the anterior curette. So for this practical, I'm going to be demonstrating using my instrumentations and mirror, the anterior sickle and the anterior curette on the mandibular facial surfaces, 3 or more on my typodont. And I'm going to be maximizing accessibility and patient comfort, and making sure that the patient's or typodonts mandibular plane is parallel to the floor, and then for the maxillary, making sure that it is perpendicular to the floor. So then this says you need to describe your instruments. So the first thing I'm going to talk about is the SH67, which is the anterior sickle. And so for this, it is going to be used supra only, and it has 2 cutting edges. And how to determine how to use it is, sorry, my cat's going crazy. How to determine how to use it, I'm going to show in my videos for both of these, but I'm going to just explain where that you can use them in determining the cutting edge. So pretty much you want to make sure that if this was my patient laying down in my chair, that I'm going to be sitting at the 8-9 position, and then for and that's going to be surfaces towards, and then for the surfaces away, I'm going to be sitting at the 11-12, which is like right here, preferably 11. And then that's going to be for anterior sickle and anterior curette. And then for the SAS12, which is the Gracie Mini, it can be used supra and subgingivally, and it only has 1 cutting edge. So now that I've discussed its surfaces away and towards, and all of those can only just be used in the anterior, I'm then going to go into the practical. So I'm going to make sure that I'm using all criteria for instrument grasp, for instrumentation grasp. And then I'm going to make sure that I am using, that I maintain adaptation of the tip to toe third of the cutting edge to tooth, and make sure that I am using the appropriate cutting edge. And then I'm going to insert the instrument beneath the gingival margin at a closed angle or a 0-degree angle. And then I'm going to make sure I'm using light pressure. And then when using light pressure, I'm going to make sure that I adapt my angulation to 60 to 70 degrees, making sure that the short or the lower or short shank is, terminal shank is parallel to the long axis of the tooth. And then I'm going to make sure that I'm using a sharp instrument, and also making sure that I'm using interoral fulcrum during all of it. I don't know why I'm holding this pencil, it just helps me. And then I'm going to talk about exploring. So I'm going to make sure that I'm exploring the tooth and root surfaces, and I'm going to be making sure that when I'm using an exploratory stroke, I'm also using exploratory strokes intermittently with scaling strokes to help locate the calculus and examine removal. So I'm going to be also using an exploratory stroke subgingivally, to remove plaque accumulation. And then I'm going to be using light pressure when doing an exploratory stroke. So now we have making sure that when we also are going to be using the appropriate working stroke when we're moving calculus, and making sure that when using the working stroke that we're using we're stabilizing and maintaining our fulcrum adaptation. And then we're going to make our grasp, we're going to make sure that we stabilize our grasp and fulcrum, there we go, when using a working stroke. And then making sure also when using a working stroke that we're using lateral pressure to remove calculus during the working stroke, and also to make sure that we are only using pressure in a coronal direction. And then we are going to make sure that we're maintaining the instrument face to the tooth. So for supra, it's going to be 70 to 80, and for sub, it's going to be 60 to 70. And then next, we are going to make sure that we are rotating our instrument with our fingers to adapt, and then making sure that we're using controlled strokes, so the appropriate lengths in our working stroke. And then also making sure that we are pivoting on our fulcrum with arm and wrist movement, making sure that I demonstrate using oblique, vertical, and circumferential strokes. And also we want to make sure that we achieve a tooth surfaces that are biologically sound for appropriate reattachment. So that was the verbalization. So now I'm going to demonstrate for you.